Good morning. Welcome back to the Action News 5 Digital Desk. I'm Andrew Douglas. Obesity continues to be an epidemic here in the U.S. It certainly is an epidemic here in Memphis and the Mid-South. In fact, if you look at the U.S. as a whole, nearly 40% of our population is considered obese, and the U.S. has the highest obesity rates among all nations in the world. Memphis ranks as second most overweight city in the country. Let's talk more about the obesity epidemic and ways we can bring that down. I'm joined now by Regina Goulder. She's a nurse practitioner with Methodist Medical Group. Regina, thanks so much for joining us. Let's talk about the obesity issue here in Memphis in the Mid-South. How bad is it? I just mentioned it's number 2 in the U.S. Do you have another number that really kind of translates how bad it really is?
So unfortunately, this has been an issue with Memphis being in the top 5 cities in America for over 10 years. This is something that we are trying to work on. We've developed information and apps, which we'll talk about later in this interview, of ways to help Memphis get healthier. We're trying to change ways of eating habits and logging your eating habits and getting this in control so that Memphis can move down on that list. Unfortunately, there's a lot of things that make this harder for Memphis, and low income. That's harder. You don't have access to the foods that can help you be more nutritious. Also, unemployment rates. We know that that leads to obesity too. So between the low income and the unemployment rates that we have here, the access to healthier foods and exercise and things like that tends to be more difficult.
What is the definition of obesity? Because some people might just be overweight, others are obese. Can you explain the difference?
Yeah, so actually they're overweight. So you go by body mass index, it's BMI, and there's ways to calculate it. You can find that even on Google, ways to calculate your BMI. And it goes by your height versus your weight. Obesity is defined as a BMI, a body mass index, over 30. That is where we consider it obese. Now, overweight is 25 or higher. Obesity, and to give you just a picture, around a 5'9" person, probably around 200, 205 pounds, that's considered obese. We don't think about that because unfortunately that's what we see all day, every day. But that is the definition of obesity, is a BMI, a body mass index greater than 30.
And some of the reasons behind it, I mean, the rise in obesity, it's our sedentary lifestyle, right? But what else?
Yeah, it's our sedentary lifestyle and our eating habits, unfortunately. Um, we know that obesity leads to lots of medical issues, including cancer, cardiovascular disease, lung disease, because you have a decreased lung function if you're overweight. But like I said earlier, it's the access to food and nutrition and the learned behavior. They're not taught. We don't teach enough on how to cut out certain foods that, one, cause weight gain, but also cause inflammation. So we deal with that, which makes a decreased activity level, because people don't want to get up and move because they hurt. But we don't realize that a lot of the foods we're putting in our body cause this inflammation.
We have thousands of people that watch us each and every morning here on the digital desk, Regina. If someone says, okay, I think I might be obese and I want to change that, is there like maybe some bullet points, maybe like 2 or 3 different things that they could start with today to better their life?
Sure. And that's my biggest thing. Start today. It's not an overnight change, and we know that. And everybody should look at that too and set goals, small goals at first, so that they can achieve things. I'll tell you how I usually sit down with my patients and talk about is reducing calories at first. We don't realize how many calories we drink in a day. So I start with drinks. Let's cut out sodas and juices and things high in sugar. Let's start there. Let's increase your water intake and cut that out. That makes a huge small change that they can start seeing things develop and weight loss developing. And then we'll start with, like, I call it a plate method. If you have a meat, a carbohydrate, and a vegetable, make sure your vegetables are larger than your carbohydrates. So we're not cutting everything out and being 100%, I'm going from this lifestyle to this lifestyle. We start small so that we can achieve goals and reward ourselves for achieving these goals so that we can be more successful. I tell my patients every day, if you do a complete 180 and you think today's the day that I'm going to cut everything out and I'm going to start running a mile every day, you're not going to be successful. It just doesn't work like that. It's small, learned behaviors and lifestyle changes in order to keep working at it. And like I said, you set more goals to attain. If you don't attain goals, then people quit. So we have to start with small goals in order to attain those.
WMC, of course, is a proud sponsor of the Healthier 901 initiative powered by Methodist Le Bonheur Healthcare. It's a challenge for Memphis and the Mid-South to lose 1 million pounds in 3 years, but it's a lot more than just weight. Healthier 901 offers a number of different tools and resources for people out there. Can you go through a little bit of that for our audience?
Sure. So I'm super proud of this. This is a great initiative by Methodist in order to try to help Memphis lose weight. Like, it's a free app, like you mentioned, on your phone. You can download it. It helps you, one, connect with other people in your area that have the same goals as you. That's very important, to be able to talk and converse with people who are trying to do the same things, because we're all going to have frustrations, and it helps to do that and communicate with others. It also has where you can track your activity. So you're seeing what other people are doing too. We're starting small, we're working up. Log your calories. I talked about calorie reduction. That's very, very important, and it's an easy way to start. It also has tips, healthy tips. So to help you get on that diet journey and more nutritious eating. I say diet very minimally because we want to be more nutritious. And then, just like I said, it just helps keep track of your overall health, your weight, and your BMI. All of that is accessible on the app.
It sounds great. I know it's a great resource and tool for people out there. Anything else you'd like to mention before we let you go, Regina?
No, I mean, the biggest thing is to know that this is not an overnight change. Multiple people struggle with this. This is not something that you're singled out with. Talk to your primary care provider. They have plans. They have meal plans. They can sit down with you and discuss for you and your weight, what is a healthy calorie reduction diet? What should you cut out first? Because we all have different health needs. So sitting down and finding a primary care or discussing with your primary care what the options are is a good way to start to get the process rolling. You can have more energy. You can feel better overall. You can sleep better. There's so many benefits of getting healthy and weight loss all in one.
Regina Goulder, nurse practitioner for Methodist Le Bonheur Medical Group. We appreciate you joining us on the digital desk. Very effective conversation here about ways to start losing weight today. Regina, thanks so much.
Thank you.